So we want to thank you so much for inviting us to be here today. And Honoree has left the building to an undisclosed location, but we'll thank her again as well. With us today, we have 4 survivors, 3 who will be speaking, Natalia, Pam, and Kathy. And we're just, I can't tell you how important it is to us and how grateful we are to you, giving your lives to caring for community members, including women who may present with ovarian cancer. So we thank you for having us here today. Yes. Joining us is Pam Wilhelmsen, and she'll tell you her story.
Hi, my name is Pam Wilhelmsen. I'm 65 years old, retired, and been having a good time up to the December of 2007. We're getting ready for the holidays, and I started feeling kind of this bloated thing, and I started having some acid indigestion, some acid reflux, something I hadn't had before. It was a little bit different for me. And the thing with it was that it was consistent all the time. Didn't make any difference what I ate. If I woke up at night, I had it. In the morning, I had it all the time. And that was pretty different for me. About December 21st, I was getting ready to go to a Christmas tea with some friends. Went to put on a skirt I hadn't worn since the winter before, and I couldn't get it zipped. I thought, well, retirement's good. Maybe I've gained a little weight. I usually don't weigh myself. I stayed the same. And I thought, no, but you're not quite feeling right, so I'm not so sure if you really have gained weight. Subsequently, within a few days, we had our family Christmas at our house, and I laughed with the kids, and I said, well, sorry, but the only pair of pants I can wear is this drawstring pair of pants that I had bought to work out in the yard. I thought it was kind of funny, but my daughter-in-laws did. I said, you know, maybe you should go to the doctor. I will, it's the holidays. December 26th, the day that changed my life forever. I decided, yep, I think I better go to the doctor. It's called my GPs. They were still on vacation for a day. Well, what do? We'll go to the walk-in clinic. So I went into a walk-in clinic. First line of defense, I get a physician's assistant. She was wonderful. She took some labs, talked to me. I gave her my classic symptoms. And then come back in, and the results of the labs showed there was no gallbladder. It's kind of what maybe thought it was. My white cell count was a little bit high, but she handed me some acid reflux medication, prescription. Take this home with you, try it if you want. But if you want, you don't have to, but maybe, we could look a little further. And I was the one that looked her in the face and said, something's not right. Let's pursue this. Okay, over to the hospital, get ready for the CT scan. They give you the great crystal light. It's not crystal light. And after drinking it for a little bit, I started to vomit. It's not so great going down. It's not great coming up. Started to vomit. Well, not knowing at that time that this tumor had pushed up on my stomach so much that there was just no way I could even get it down. So they sent me back over to this clinic, to this physician's assistant, to get the results of the test. She puts me in a room, and then there's a little commotion. She's talking to a doctor back and forth, not paying too much attention. She comes back in. This is important. She's pulled that stool right up next to me and took my hand. She said, you have a large mass in your abdomen, and it's probably ovarian cancer. What? What's ovarian cancer? I mean, I knew Gilda Radner died from it. That's all I knew. Get my husband, we need to talk about this. So they sent me back for a pelvic ultrasound, made an appointment with my GP, said I would probably be sent on to a gynecological oncologist. All of that happened the next morning, and I had surgery on January 2nd. So I was very fortunate. My very first visit to the medical community, I was diagnosed. Then it was, what are we gonna do for treatment? So, and I was diagnosed, by the way, with stage 3C carcinosarcoma ovarian cancer, which is a little bit more difficult to treat, quite aggressive. So we decided that I would have an port had actually been put into my abdomen at the time of my surgery. So I had the IV and intraperitoneal treatment. That means you get, you know, the drugs IV, but they also put it directly into your abdomen. It's not very nice. It's very difficult. Not only do you have the chemo, you've got the nausea, you've got the metallic taste in your mouth, you have that, got the blahs, as a friend of mine says. You know, they're filling your abdomen with 2 liters of fluid, and I'm not very big. And it was a tough treatment. Said a lot of patients don't make it through and that kind of thing. Well, with my faith, my strength, and my courage, and the support of my family and friends, I made it through the 6 cycles of treatment. We're very proud of that. May 2008, I was considered in remission. CA-125 had dropped. Oh, by the way, I should tell you too that if that physician's assistant, CA-125 is not a good screening tool. But if she had tested that when she took the test with gallbladder, it was 2,500. Normal is in the 35 range. I still was diagnosed the same day. But so then I followed up with 3-month checkups. I go, you know, when we have the blood test, checking the CA-125, it stayed low. January of 2009, it started to go up just a little bit. And then by May 2009, it had creeped up even a little more. I had a CT scan, didn't really show anything. My wonderful doctor said, go and take the summer off and have a great time. So I went back in August, and not unexpectedly, the CA-125 had risen quite sharply, and within 2 days I was back in treatment. This time I had Taxol carboplatin, just IV, which sort of seemed like a piece of cake after what I had been through before. Continued that through the winter, 6 solid months of this, got a little long. But the CA-125 continued to drop. So we're very fortunate about that. I do not appear at this point to be platinum resistant. So it's working. As of April, I kind of leveled off my CA-125 in the 20s, and it's staying there. I'm now considered in remission again, and I will continue to have checkups every 3 months, and I am set for another CT scan to see if there's anything. One day at a time. I rejoice in my health today. I stay active, and we'll see what happens and what maybe is handed to us. I'm ready, sort of like childbirth, you know, you kind of forget a little bit, so I could maybe go back and do it again, which may happen. So, I guess my thoughts for you folks are, what as physician's assistants can you do to make a difference? And as we've told you before, it's, especially you folks, you're the first line. You're the first line sometimes. And to learn some of these symptoms, we all have them. Indigestion, bloating, some of this kind of stuff, we all have them. But they're different, they're consistent, they're sometimes things these women have not had before. And when they're looking in your eye and say, something's not right with my body, it's a real sign. And I just would ask you to remember us. We are the faces, the 4 of us, of ovarian cancer. Remember us. And maybe someday in a practice and you talk to a woman, that little light bulb will go off and say, you know, when I was in school, in fact, it was the day of my final exam. There were these women that came in and talked to us. And we, you know, I'm just hearing a little bit of this. And let's rule out ovarian cancer. Thank you.
Thank you so much. What we'd like to do at this point is just take a minute. We're going to set up. Yes.
If we see the symptoms that you're talking about, the first line screening is CT scan, or what? Is that the correct thing to order? Do you guys?
Would someone like to take that, speaking from their experience, what the procedural, what the steps were? Can you take that, Ben?
No, sure. I don't know, medically, it's a little hard for us to answer questions.
Yes.
I mean, I think as you understand too, we all have such different stories. It just happened that I was sent for the CT scan. And of course, that's what we follow up with now, are CT scans. And so I would imagine, or pelvic ultrasounds probably are what you're gonna, what you would find. I would think that.
Mine was just more a comment about how I think it was very invaluable that PA took that opportunity to say, we can push this another step further. I think a lot of us have a mindset, well, we want to save money, we don't want to waste patients' money, we don't want to push it too much, and because as much as that can be helpful on one end, it can be a burden if it doesn't turn out to be healthy finding too. So I think that's just something to try to keep in mind. Always give it an option to people and make it something much short. So
In general, as I mentioned, I'm talking about this physician's assistant, such a perfect group to be talking to here, is one that she did do that she was so gentle in her saying, let's pursue it, it was really up to me. But also the fact that this woman came up next to me and sat right next to me and pulled her chair right up. She knew she was giving me not good news. And she took my hand. I mean, this has been talked about before in some of these other survivors teaching students. They've talked about how would you want to be told and that kind of thing, and bedside manner and all that. And I can't tell you what that meant to me, that she knew. Just tell you about referring to a gynecological oncologist. This physician's assistant, again, I give her a lot of credit. She did not do a vaginal or rectal exam on me. She would probably have felt that tumor if she had. To tell you what, I always refer to a gynecological oncologist if you're unsure about this, because they really are the experts. And this person that I went to was so good that we came in there on short notice, and he said, I'm not going to look at what's been sent to me so far. He said, I'm going to do that after I talk to you and after I examine you, and then we'll see. So he hadn't looked at what was going on. He had heard some of the symptoms. He didn't look at the records. He did a vaginal and rectal exam on me and said, you have stage 3C ovarian cancer from that physical exam. Then he went back and he said, now I'll go look at the reports, and he was right on. There is extensive breast cancer in my family. Really, I had 2 sisters, 4 nieces, and all this kind of thing. And so I guess I never would have been very surprised if they had found breast cancer. That was kind of always out there for me. All of us that have, in my family, that have had cancer have had the BRCA1, BRCA2 testing, and we do not have the gene. So we are actually thinking about going into a research project through one of the bigger hospitals that is looking at familial relationships. And again, maybe they're going to find another one, but we do not have.
Thank you. Very good. You did very well, grasshoppers. You did very well. If you'll remain seated for just a moment, if there are no other questions, if you remain seated for just a moment, what we're going to do is we're going to hand out the post-test. It's not a test, it's a survey. And then we have goodie bags for you. So don't leave. Oh, and if you have individual questions, we'll be around for a little bit afterwards if you want to chat privately.
A panel of survivors from the Wisconsin Ovarian Cancer Alliance, and they're here to share their story and tell us a little bit about the disease and the disease process, and what we should all know as healthcare providers. So I hope you're all good listeners, and will begin. And I'll let them introduce themselves. However, everyone knows my clinical group is a challenge, but I want you to watch this. Laura, Pam, and Kathy. Let's give it up. I'm terrible with names, so I'm going to shut the door and enjoy it myself.
Hi. I want to start by thanking you guys for having us. It's the passion of our lives. All three of us are survivors. And so it means a lot to be welcomed into this group, and it's really important to us that healthcare providers begin the listening process and the asking question process around this disease. So we want to thank you. This is a program that is overseen by the Ovarian Cancer National Alliance in Washington, D.C. And we are affiliated with the Wisconsin chapter of that alliance.
My name is Pam Wilhelmsen. I am 66 years old, retired. I was an accounting manager for Sargento Foods in Plymouth, Wisconsin. My story is getting longer, a little longer and a little harder to tell, and you'll see what I mean when we get into it. First of all, you need to know that my life is joyous. In between all these ovarian cancer journeys that I've been on, I have a wonderful life, and I'm very grateful for that. I'm here today because of the support that I receive from my family, from my friends, from my church, people I don't even know, and my medical team. I am here today. I feel very strongly that there was a faith journey plan here for me, and I think what it is to bring ovarian cancer awareness to women and to the medical community. My story begins in December of 2007. I had started to experience some acid reflux. Any time of day, all the time, no matter what. 2 daughter-in-laws with this. What do you do? What should I do? Oh, a little Xanax, something like that. Nothing seemed to help. It was so persistent. And then I started to have this swelling in my abdomen. Went to go somewhere at Christmas time and couldn't get the skirt set. And I thought, well, retirement's good. Maybe I gained a couple pounds or something like that. I normally don't weigh myself. Kind of put it off. We had our family Christmas celebration. And I'm laughing with the kids and said, oh, sorry, the only pair of pants I can wear are these drawstring pants. And my daughter-in-laws are just like, oh, Mom, you better do something like that. Yeah, it's the holiday, I'll go. But knowing that I didn't need to do that. So on December 26th, I started, getting a hold of my regular doctors. Oh, they're on vacation another day, so we go to the walk-in and that kind of thing. And PA saw me. I explained to her my classic symptoms of what was going on. She took a blood test and we waited, and the blood test, she comes back and she said, well, it's not it doesn't appear to be gallbladder. Your white cell count's a little bit high, but she hands me some acid reflux medication. She said, you can try this, and it probably will help. But she said, we could pursue this a little bit if you want. I could send you over, you could have some tests and things like that. And here's what's key, and I want you to remember to listen to this. I was the one that said to her, let's pursue this. Something's not right with my body. Long story short, CT scan, got to drink the Crystal Light. It's not great going down. It's even worse coming up. And, had the CT scan, come back to this clinic, and this nice PA sits me down, takes my hand in both of hers and says, you have a large mass in your abdomen, and it's probably ovarian cancer. I have what? What do I know about ovarian cancer? Guilt-red or die from it. One and only fact that I knew. Well, now I know a lot. So anyway, I was sent immediately to a gynecological oncologist, as Laura has stated, critical, just very critical. And I had surgery within days. After that, it was okay, we need to do chemo. I was actually diagnosed at that time with stage 3C carcinosarcoma, ovarian cancer. We sent to this gynecological oncologist. We reviewed a little bit chemo treatment plans, and we eventually chose a very aggressive and difficult treatment. I had both IV and IP, it's called. It's intraperitoneal treatment. Treatment goes directly into your abdomen. It's very difficult, along with all the other chemo reactions of feeling well, and I really didn't get sick because they've got great medications now, but basically not feeling very well. They do fill your abdomen with this a tremendous amount of fluid, extremely uncomfortable. Went into it with them saying, well, half the women make about half the treatments scheduled. And they're matched with me and my family, and I made it through all 6 cycles. Just did, out of pure stubbornness. May 2008, I was considered cancer-free, and life went on. After that, I had 3-month checkups. These are very important, these follow-up checkups. CA-125, I don't know if you're familiar with the CA-125 test. Once you, especially you've had the cancer and it's been treated, there is a blood marker that became my marker for where I am in the battle. It's not a screening, it's not really good for a diagnosis. However, if that lady had taken a CA-125 blood test that day, it's normally in the 35 range is a good one, although it varies for everybody. Mine was 2,500. I was very, very, very lucky I was diagnosed the first day that I went into the doctor. That's uncommon with ovarian cancer. Most of the time, these symptoms are so similar and we all have them. Maybe you have some congestion, you get bellyache, your stomach gets big. I mean, it's pretty common stuff. And but anyway, I was still diagnosed the same day. And I will say that during these very difficult treatments, it was really the nursing staff. This is real important. You were the ones that held my hand, administered the treatments. You were the ones that asked tried to answer my first line questions. You were the ones that supported me when I wasn't maybe doing so well, referred me on to others if you thought, it was appropriate. So your role in all of this is extremely important. So then I continued the test. Well, 13 months after that remission, in August of 2009, checkups, CT scans. In August, my CA-125 was up over 800. Well, where it had gone, it had metastasized where I had this port in my abdomen. That's where it metastasized. So we headed immediately into treatment. This time I had carboplatin and Taxol, only IV. I don't know if they could talk me into that intercare. Anyway, I went on with those treatments for 6 months and had my last treatment in February of 2010. We went to Florida at the time, so forth and so on. Now we're continuing with the 3-month checkups again. I had a CT scan and blood test at the end of June 2010. CT scan came back beautiful, really, really clean. Oh, the doctors, they high-fiving, and the PAs, and everybody's all upset. This beautiful, beautiful CT scan. But C125 is up to 100 from a low of about 22. Something's brewing somewhere, we don't know where. Let's take that 3-month break again and see where we are at the end of September. Well, within 10 days after this beautiful report, we're off vacationing the 4th of July, and I start to have some vaginal spotting. That's not right. That's not right. So immediately, I got the doctors, and we got the consultations, and we've got the blood tests, and we're going through the whole drill again. And subsequently have found out that I have a tumor in my vaginal wall. This does not show on a CT scan. Vagina is very difficult to see really clearly on a CT scan. So here's this nice little tumor hidden in there, and biopsy, it is cancer. I cannot have a combination Taxol platinum chemotherapy again. It's just not working. My remission was only 5 months. That's not long enough. So if we went to chemo, it was going to be probably Doxil or something like that. But this time they decided, let's see if we can't do it with radiation. So, more doctors, more consultations, and I am going to start radiation Monday. I will be having radiation to my pelvic area for 15 treatments, 5 times a week for 3 weeks. And everybody seems to be pretty optimistic about that it's going to get it this time, that it should be quite immediate and thorough. And also gives me a break from chemo for a while. Let my body rest and stay away from the chemo for a while. We have also scheduled a consultation with a clinical trial specialist. We're getting ready for, okay, what happens next? This will probably recur. It has become a chronic disease for me. And we're just kind of laying the groundwork. This is maybe what we could do. This is what's out there. Here's maybe some possibilities and start to prepare. But in the meantime, we're going to have a stretch after this is done. So, what about you nursing students? What's your role in that? You are so extremely important to us. First of all, when women come into the doctor, who's the first one that generally sees the patient? You're the ones that sit, you take the tests and you answer the first questions, and maybe you're the one that says, why are you here today? What can we do to help you? Try to remember those symptoms and maybe ask some more questions. It's something you're going to hear quite often, these symptoms, but something sometimes just reads differently. And a lot of it is when the patient just says, you know what, something's not right. Something's not right with my body. I know what my body feels like and something doesn't feel well. And you're also the ones that support us during our treatments. And this role is critical. I always had just the best. Of course, you get prejudice. Just the best nurses. And the ones that, were the ones that like I said, held my hand and reassured me and asked my questions, tried to answer my questions, and just in general, you're extremely, extremely important to the ovarian cancer, or any cancer patient, all your patients really. But I like to, in general, thank the nurses and all they do to help care for these patients. And I'm hoping someday, sometime, in your career somewhere, you're talking to a patient, and the little bell goes off, and you say to yourself, I remember when I was in school, there were these ladies, they were a little crazy, there were these ladies that talked about ovarian cancer. And I want you to remember our faces, and maybe somebody will save someone's life because of it. I don't, they asked for pictures of it. The first one was taken during my first round of treatment when I had all my grandchildren put tattoos on my head. It was a good thing for them because they had the opportunity. It was a little scary for the grandchildren. They picked out their tattoo and put it on their head. And some were harder to scrub off than others. They lasted for a while, but it was a very fun thing. The next picture is a picture of my last day of that first round of treatment. I'm probably, my abdomen is probably about this big from all those fluids that I get. But my husband is on the left, then my daughter-in-law, Michelle, my son, Eric, my daughter-in-law, Cheryl, who is here today, and my son, Scott, always surrounding me, always. So we kind of celebrated that day. This was kind of fun, last fall. September is Ovarian Cancer Awareness Month, and the football team at Plymouth helped us put these ribbons around some poles and trees and stuff in Plymouth. They all had mohawk cuts, and of course I was bald. So we thought that was kind of fun. So.
And we brought ribbons that everyone can get a piece of ribbon and they can start to think about where they're going to tie it in September.
So that was fun.
Thank you so much. I think she's inspirational. Scott, did you need to step out?
Yes.
Okay, I just wanted to give you a chance to do that.
That's it. What is it about?
Yes,
What kind of side effects did you ladies experience from the chemo, and what do you recommend for us with such an aggressive treatment? How it helped you through it?
can you take that, Pam? Because you've been,
Yeah, I did, all different kinds going on. The IP treatment was something on its own. It really was. It was pretty tough. One doctor had said, you're going to be in excruciating pain. Hey, gee, you know. And that's not the case. That's not what I would describe it as. I think most of it we can blame on that fluid that goes in with this treatment. And, you know, obviously, I'm not a very big person, and so they just keep pumping that fluid in, and it was like, oh, that was so uncomfortable. It take about 48 hours for that to go away, to kind of, you know, work its way out and pee it out and all that kind of stuff. So that was uncomfortable. We have a friend that has a different kind of cancer going on, and his description is the blahs. You know, I really didn't have nausea. They have wonderful
there's a ventral
medications.
patch now.
Yes, they've got wonderful medications that really help control that nausea. I don't know if you really actually got sick.
I took a few, it was like the first 3 days afterwards, but after a while, it's
They
like,
really
I
help.
couldn't
Yeah.
eat.
Oh, yeah, no,
And I lost all kinds of weight. I mean,
Yeah.
when you had chemotherapy, they put out the sandwich cart by and said, I don't want to see that.
I had this, so you really don't get sick, but the feeling of the blahs.
Yeah.
And I got
You're very
this-
fatigued.
And fatigued, and then this, if she said this not eating, it's like everything, I describe it as a metallic taste. I have a nurse thing, as long as we're talking to nurses. I had the surgery, you know, it's major surgery, and it's not too hot, you know, so you're kind of in this. And that very first evening, this woman was on the night shift. So everything was kind of dark, and I'm kind of in it. And honestly, I felt like she was an angel. and she had kind of a mop of curly hair. She was an angel. She just was so soft and kind and gentle to me, and it seemed to just be in my place with me. And my husband and I talked about it a couple of times, about this absolute angel that was, and I've said, I think they put her on that shift for people that have had, you know, major surgery, because she's just the one. You know, and this is where I, you know, said, you folks are the first line. You're the first line. You're the touching. You're the touching. The other, the doctors, you know, are, you know, kind of at the church, you know, although they're better. I think it's better than it's used to be. But you guys are the first line with the patient. It's very important. You can make a big difference. Make a big difference.
Can I ask about the, experimental studies that you had signed up for? Do you know?
I don't know yet. We're having a consultation. Because I can't do the first line carbo or any kind of a Taxol platinum-based drug anymore. That's kind of done. Now you're going on to other chemos. And because I am obviously recurrent and chronic, and it's probably going to show up in other places, my gynoc thought it was probably an appropriate time to look out there. Maybe I'm interested in a little more risk. Maybe I want to be on the bleeding edge a little bit. So I don't know. We're having a consultation.
Have you talked to Natalia?
No, I know she was in the clinic.
Yes.
Yeah. So I don't know what it would be. But now I also know. I went to a conference last week. And I don't know if we remember going to that, but at any rate, I have some leads for people that would really know about clinicals, and I can say, well, these 3 are possibilities, and I have some people who really look at it for me. And I'm not interested in being a campaign, but I also, you know, would like to kick this if I could.
Yeah.
I have things to do.
And there's research lined up like planes at O'Hare,
Yeah.
waiting to take off. But it's a matter of funding. It's a matter of funding. And this year, all ovarian cancer is asking for is $50 million. That's all. That's all they're asking for. And 30 million of that is done through the department.
18.75 is all.
Is that all they got?
From the Department of
We were
Defense.
asking for 30.
Figure that.
We were asking for 30. But she actually read research submissions with the DoD. That's where she was last week, was as a patient reading through proposals, which I think is amazing. And I think I would like to
Try to summarize it in a nutshell. It was kind of a long process to be accepted into this program, but I decided it was important to do. So I did, and I was pretty much over my head medically. I sat on a panel of about 15 people. We went through 39 proposals that researchers and doctors had submitted for grant money, all in ovarian cancer research. And it was narrowed down to people that are taxane resistant or chemo resistant, which is sort of like in the whole process here I have become. This was pretty new research because it was sort of like I said, it was really the petri dish in the mice. It didn't quite go much further than that, but some of it will at some point.
So are you talking about phase 1 trials? As
No, I
opposed to
didn't even
phase
go,
two,
it wasn't
phase
even
three?
talking
Oh,
about
okay.
phase
All
1
right. We're not talking
trials.
about
It was
trials.
really petri dish
Okay.
in mice. And then maybe a clinical trial.
I see.
So my role on this panel of researchers and doctors and ones that knew all about the molecules and the pH 1s and 65-30s and all that kind of stuff, which I don't know anything about. My role was to always say, what are the side effects? What is this going to do to a patient? So that was my role, to be the one. They don't really think that far, and it was just my little nag at all of these proposals until I had to kind of laugh. I was sitting next to a PhD researcher right next to me, and I had said my piece already, and then he piped up and was asking some of the question. He said, and as Pam's favorite phrase would be, what are the side effects? So I think they did hear after a while, because it just was repetitious. I mean, at some point you're talking about a woman that's going to maybe have this treatment, and if it works, who knows? But how's it woman? It was very, very interesting. And I said, I'm giving my government one. It was very well run, very phenomenal. I don't know what we do without money.
Yeah, that's for sure. And so there are ways that this can be detected. It's just that we need to sensitize ourselves to how we detect it and to educate us, women, patients, about what to listen for too and getting to know our own bodies.
I think one of the things I've been trying to tell people when I talk to them is, I know that maybe the medical community doesn't want to be, bothered with everybody coming in and saying, I think I have ovarian cancer. But if you really think you have some of these symptoms and it's persistent and it's your body and it's how you feel, it doesn't hurt to say, can we rule out ovarian cancer? Say the words. Say the words. Say the words. And that's being directed to the patient. But many of you in this room are women. Can we rule out?
Yes, and yes.
This question is more for Pam, but anybody
Good.
can feel free to comment. You talked about the 3 month, you go in every 3 months. How do you play that waiting game? I think I would just worry
It's a
about
head
that.
game. It's all
It
about
is.
what goes on. The entire progression of this journey for me is all in my head, basically. It's, doctor appointments come up, something's not right. What am I going to do? What's the worst case scenario? So forth and so on. It is a head game. And I work real hard at it. Because, and that's why I'm here. I really think that's why. That and the support of my phenomenal family.
I want to ask, so since we've got two spouses here, what's it like for you guys? What's it like for you guys? Because you're, as nurses, you're taking care of the whole family, right?
Number one, you've got to have track shoes on to keep up with that. Until 2 days before her next appointment. At which time I could sense, her mood change.
Right.
And she just shuts down. And I know she's gone in her little hole. And I can't say anything. She's the one that's going through it.
Yeah. Anything you want to say, Paul? This is my husband.
Because Laura is obviously so energetic, we tend to, I think both of us tend to forget that it's even there until like a 6-month checkup.
Yeah.
Then it all comes back to you and it becomes a reality again.
I always felt like, a lot of people ask that question. So I think that was part of it for me. What about
And a
you?
lot of, I think, a reference to, I could stumble once in a while. and it was always a smile, and I'll get someone maybe that can help you out. I'll tell you another quick little nurse thing. Very first time they introduced the Taxol, was the very first treatment I had. Cheryl and Brett were there, and I was kind of like, did they start that stuff? And they said, well, yeah, they have. And I said, I don't think I feel very well. And well, all of a sudden, I went into a shock situation from this Taxol. That nurse immediately jumped all over it, and she had a doctor there in a couple seconds, and it was over as fast as it started. And she was given permission to sit with me the entire rest of the day. And she did. She sat right next to me the entire day, and it was so comforting, not only to me, but to Cheryl and Brent who were there that day. So it was just that sometimes that extra little, and I think it's touching. I mean, we were talking about that before. And many people will say, no hugs. My sister was very, very ill with cancer at one time, and she told me when I asked her if I could rub her feet, and she said, nobody touches. So it's a touch, it's a blanket that we're there. You gotta know your patient, but just sometimes a gentle touch is always needed.
Anything else anyone wants to ask? Well, we're going to ask you to please take an exit survey that will help us understand how successful or how well we did in imparting the information that we feel like we're trying to pass on. And then we'll be available if you guys would like to ask questions. Did you want to chat? Oh, yeah.
Okay, so this morning we have Laura Clark-Hansen, who's going to be speaking with you, and she and 2 other survivors are going to be the speakers that we have this morning. So I'm going to actually let them introduce themselves and tell you a little bit about their stories. And then, again, I'm assuming you're going to perhaps want some response from them. You might be having some questions?
Absolutely.
Okay, good. All right. So on that note, I'm going to get out of here and let them speak.
I mean, seriously, thank you. And congratulations, everybody, in advance of Saturday. This is absolutely exciting, and I can say on behalf of both Pam and Jan, we are deeply grateful to you for your time here in education, giving yourselves to the health and wellness of people in the state of Wisconsin, or whatever state you are, practicing. We're just deeply, deeply grateful to you. Hi, my name is Laura. We are survivors teaching students saving women's lives. I'm going to let you finish, and as soon as you're finished, you can pass them down and we'll begin. We'd like to thank Brett and Paul, who are 2 of the husbands in this team. Can you guys thank them? Thank you. We are survivors teaching students saving women's lives. It's a program that's brought to you by the Ovarian Cancer National Alliance out of DC, but it's also, we're also affiliated with the Wisconsin Ovarian Cancer Alliance, which is right here in the great state of Wisconsin. Morning. My name is Pam Wilhelmsen.
I am 66 years old, and before I start this story, which is quite a bit different than Jan, and that's what we are talking about here, because ovarian cancer doesn't have a simple story. My life was wonderful, full of joy and having good times. My story is getting harder to tell in a short time, because it continues and continues. The support of my family and my friends and my church and other organizations and my medical team have gotten me where I am today. What's important here is this diagnosis. In December of 2007 was when I really first started noticing things. Classic. Kind of had this full abdomen, probably peeing pretty often and that kind of thing. We had retired the January before that, went to go to a Christmas tea, couldn't get my skirt zipped. My weight has always kind of stayed the same, and I was like, retirement must be good. Couldn't get that skirt zipped. But by Christmas, that clothing was getting pretty snug, and my two daughter-in-laws kind of said, oh, Mom, you really should go get that checked out. So on December 26th, day after Christmas, I went in to have this checked in and ended up at a walk-in clinic. Important part here is I saw a physician's assistant. She ran some typical stuff, Dave's gallbladder. She took a blood test, and it was, maybe looking for white cells and that kind of thing. And she brought me back in after I had that done, and she said, well, I'm really not seeing anything on these tests. She said, and she handed me some acid reflux medication, thinking that's what it is. Really typical to think this is IBS, acid reflux, that kind of thing. And the reflux was what was bothering me, too. And she said, but if you want, you don't have to, but if you want, we could pursue this a little further. And once again, like Jan said, something's not right. Let's take this further. So subsequently that day, I had a CT scan and came back and to meet with her, and she was the one that pulled her stool right up next to me and took my hand and said, you have a large mass in your abdomen and it's probably ovarian cancer. What? What's ovarian cancer? Well, killed your red or died from it. That was my one and only fact. What's remarkable here also is the fact that I was diagnosed the first day that I went in to have this looked at. This is unbelievable that it was diagnosed that first day. The diagnosis was, Jan, went a long time. My first trip in, and I was diagnosed with stage 3C carcinoma, sarcoma, ovarian cancer. So things started to roll quite quickly, and within less than a week, it was the holidays, this is a problem, I was sent to, again, a gynecological oncologist. Good move on the part of that PA. She and her team sent me immediately to a gynecological oncologist. And I did have the surgery quickly. Then it started. So my first rounds of treatment were cisplatin and Taxol, and I had an IP where they put it directly into your abdomen. A little tough, not much fun, but I got through 6 treatments. I got through all of them and was considered cancer-free. That lasted about a year, a little over a year, something like that. And my CA-125 started to go up. Now, CA-125, I'm assuming you've learned about this, it is not a good screening tool. It really isn't. And it really isn't a good diagnostic tool either. In many cases, it can be deceiving. You can get false positives and false negatives. Perhaps if that had been part of this blood testing that I had done that first day, it was 2,500. Normal should be in the 35 range. That would have also been an So I was diagnosed that first day. But if that, you know, the other things hadn't led to that, that would have been the key to get going. So my C125 started to go up in August of 2009, up over 800. Okay, what's going on? Get the CT scans. Well, it's metastasized and has some small pockets in my abdomen. Likes to metastasize where they had that port in my abdomen. So it's a weak spot. And those little cancer cells love to look for those weak spots. So I started a traditional carboplatin and Taxol just IV. Went through all that and was done in February of 2010. Once again, I'm cancer-free. Well, June 2010, we're having a 3-month checkups. Had a CT scan, oh, it's really clean. High fives, you know, it's doing well. Ooh, that C125 is up to 100. Something maybe is clipping, I don't know what. Within weeks on the 4th of July, I started having some bleeding. Well, everything's gone, you know, what's that? So we go in, exams, test, and I have a tumor on my vaginal wall. Okay, what are we gonna do about that? Okay, let's try some radiation. So I had radiation to just my pelvic area, seeing if we could get that tumor that was in my vagina. Sort of good news was that the radiation stopped the tumor from growing, but it did not eradicate it. So we were a little disappointed in that. C125 again is starting to rise a little bit. So now what are we going to do? We think that the Taxol carboplatin routine might not be, am I resistant to the platinum? We're not sure. That might not be the answer right now. Probably going to have to try something else. So we decided to try a phase 1 trial. So in November this year, actually 2010, I started a phase 1 trial. And what it was the traditional Taxol carboplatin with an oral drug that would serve as an enhancer of the chemo. And, you know, let's see how that works. Really some good news about that is it just really whacked that cancer. It attacked it very well and quite quickly. The results were really good. It did enhance that chemo. So it was, you know, all of the side effects and all of the chemo were enhanced. So it was kind of a rough time. In February, end of February this year, I had progressed along and it was really taking a toll. It was taking a toll on my magnesium. I was having magnesium infusions twice a week to try to get that magnesium where it likes to be. The carboplatin will do that. And I also had started to have some really severe allergic reactions. We weren't sure where it was coming from. Was it the experimental drug? We didn't know. The red face. I had 2 complete face peels. I was telling more about that. I don't recommend the process, but my face is totally peeled twice. The on the drug, kind of off the drug, trying to get me through. We were hoping for 6 cycles. We stopped after 5. The allergic reactions too much. The magnesium levels were too bad. I did try to take just the oral drug for a little bit, hoping it would serve as an inhibitor. They don't know. It might be an inhibitor. After only 2 doses of an allergic reaction again. So I have, you know, I'm subsequently off that trial. My C125, which is a good measure for me. We've used it for me because it's a good, it might not be for all ovarian cancer survivors either. It's a good indication for me. So right now I'm at 34, which is pretty good. We'll take it. We're hoping, of course, for a longer period of time of remission. And so, you know, the battle may continue. You don't know. Hair's coming back, that's good. All of that kind of good stuff. This picture is kind of fun. My first round, a couple of my smaller, younger grandchildren were not so sure about losing that hair. And so we decided that they should put tattoos on it. And so they did that, and it was great fun for them. So, you know, in speaking to you folks, just to let you know that sometimes you're our first line. You're the ones that talk to us, you know, what's going on, we give our symptoms, talking about what's going on. And many times, it's really you folks are the ones. So I'm asking you to listen to what these women have to say. Something's just not right. My system's always done this, and right now it's doing that, and it's just not the same. And to listen, please, to what they're saying. And maybe someday, in your practices somewhere along the line, some woman will give you one of these symptoms, and you say, you know, I remember when I was finishing up school, day after I took my final exam, there were these ladies that talked about ovarian cancer. Let's just take a look at that. Maybe that's going to make the difference for someone, because it is an early diagnosis. And we appreciate it. Remember us, we are the faces of ovarian cancer. Thank you very much.
This is a picture of Pam with her amazing family, Cheryl, who was at all the presentations, her daughter-in-law. I think all of us our second line of defense after we leave that medical office is our families. And I think all three of us are blessed with wonderful co-survivors. And Pam, you've been involved in lots of different activities. This is one of the runs that you did.
Taking the town teal in our hometown.
September is a very...
football team.
That's the football team in her hometown. And September is Ovarian Cancer Awareness Month, so I'll say more about that. Thank you very much. Yes, the gentleman, and then we'll go to the woman in red.
What have you all found to help with chemo side effects? Was there anything that worked particularly well for any of you?
Pam?
Well, my support group. I have found that my faith and my support group and my husband saying, what do you want for supper? And me saying nothing. And he's saying that's not a good answer. and making sure that I eat. Lots of fluids. And sometimes it's really hard. You don't want to drink that water. I don't want to have that Gatorade. And that's what I would say fluids are probably among the best. They have so many wonderful drugs now.
Mm-hmm.
And they do not want you to be sick. I was told you can throw up once, you get sick the second time. That's not acceptable. Because you find that the medical teams really will do whatever they can. I've been very, very blessed that I really haven't called on the drugs very much. The exhaustion is probably the word, and it's just a matter of giving into it. And I still continue to exercise and be active, and I don't know if they've found, but a lot of this is right up here.
Mm-hmm. Yes.
It's really up here, and so that's where my battles are. It's up here. And so the support and the faith and all that kind of stuff, I hope it doesn't sound kind of hokey, but it really does make a difference. And if you're having problems with that, find some help.
Just as a last and final reminder, thank you so much. Thank you again, Honoree. Can we thank Honoree? She's awesome. And we have some gifts, the parting gifts that we'll be leaving with you to hand out to them as graduation gifts.
Okay, I know that, why don't we take a quick bathroom break, how about 5 minutes? And then if you have individual questions that you'd like to ask the patient,